It was the COVID-19 pandemic that catapulted the industry to new heights. Kenyans working from home spent hours watching themselves on camera, endlessly scrolling on social media and experiencing downtime from social events. This all benefited the plastic surgery industry, which saw a record number of patients as pandemic restrictions were lifted.
As society places more and more pressures on everyone to have a specific body type, people have chosen to go and get it done professionally. Various institutions that offer such services have popped up all around Kenya, the Da Vinci Hospital being one of them. Today, we get to interview Dr. Andrew and Caroline Sandy for this week's feature on the rise of the cosmetic industry in Kenya.
Okay, I had a BBL. Yeah. That is like a fashion plan, fast transfer. So I had fast removed from my midsection to my hips and backs. Yeah.
Why did you choose to do it? Like, what did you...
I was kind of feeling uncomfortable with how I looked before. It's not like I looked bad, but I was not very impressed. So yeah, I decided to do it.
I'm a plastic and reconstructive surgeon. I've been in the industry for the last, as a doctor, working for the last 14 years. Yeah, so I recently ventured into plastic and reconstructive surgery, more on the cosmetic aspect.
We got a chance to see how breast reduction is carried out, as well as see the different facilities they offer. Cosmetic surgery has been on the rise in Kenya, with more and more people and celebrities coming out to speak about the various procedures they had done. In the theatre, a hard-working group of surgeons are seen operating on a woman. She has had large breasts and is in for a breast reduction. Before one goes under the knife, a lot of consultation is done beforehand to ensure that all parties are aware of what will happen and what to expect. Most will go under using general anesthesia, where procedures last up to 3 hours, after which they are transferred from the theatre to the recovery room and finally to the ward. Behind all the glitz and the glamour, there is a dark side of this. Due to quacks or unregistered practitioners, there have been botched cases. One way of avoiding such would be by confirming with the list of accredited practitioners, online or physically, at the Kenya Society of Plastic and Reconstructive Surgeons Board.
We have the non-invasive, cool sculpting, laser surgeries, so those are the non-invasive ones, and then we have the invasive one, which you really have to go under the knife. Under the invasive, which we practice a lot here, as she's referred, she had Brazilian butt lift, that's what we call BBL, and it involves removal of fat from your lower body, the abdomen, and transferring to the hips and butt to give you that shape, waist shape. What I need to emphasize is ensure the person who's doing a surgery is a board certified plastic surgeon, and that list you simply go to the society for Kenya Society for Plastics, Reconstructive and Aesthetic Surgeons, where we have a list of all the surgeons who have been registered to actually perform plastic surgery and cosmetic surgery in this country.
Were you scared?
Not really, I was excited. Funny now. I was excited because I really wanted to do a surgery.
What, on a scale of 1 to 10, 10 being I want to die. How was your pain level?
Okay, maybe a 5.
What?
Yeah. Yeah, I don't know, it's because I was ready for it. I really wanted it so bad, so I was able to cope with it. It wasn't that bad. Slimming, pills, slimming, creams, always. But they never work. They don't work. To be honest.
Are they safe, Dr.
From a medical point of view, they're not. Because you see, most of the time you don't know the content, the ingredients that are used to make those slimming pills or those oils you're talking about. Some people go as far as putting mercury in some of these creams that ladies use, and you see that is something that can really cause a lot of damage and even lead to you getting cancers later. So what beyond that, when you've used those creams and those pills, which are more herbal in nature, when you come to us in the institution, it increases your risk in the hospital of getting a complication because they damage your kidneys, they damage your liver. You see, you won't see, but then when you go under, then it becomes risky. So what we normally advise, if it's something that has not been approved by the Pharmacy and Poisons Board that regulates medicines and poisons for use by humans, then it's not safe to do that.
After the surgery, when the patient is feeling up to having a spa treatment, they head into the spa and are pampered accordingly. The facility also offers massages to drain the lymphatic fluids to ensure full healing. With every institution, there are challenges faced by each one. In this industry, the secretive nature of the patients is the main challenge. Patients choose not to speak about the procedure in fear of the stigma associated with the cosmetic industry.
The challenges that you do face in the market is people are not coming out and saying actually that they did plastic surgery. There's a bit of social stigma that you're trying to address through educating the public about the safety and what you can get when you undergo a plastic surgery procedure. That issue of not coming out, because most people in the social media and Instagram have actually undergone the procedure, but they're not coming out. They'll tell you, oh, I've used corsets, or I've exercised, but for us, we know that you actually went. And if you walk around just in the malls, there's the normal, you know, when you're in Africa, you know, there's a normal African shape. And there's one you look here, is like, wow, the surgeon did a good job. So we want people to be comfortable, that plastic surgery is a reality. We're having a lot of women doing it and embracing it. And there's no shame in wanting to make yourself look better for yourself first, and maybe for your man. And even the men are coming and they want to look, they want to have abs, artificial abs. We do it for them. We have even other aspects of plastic surgery. So it's we need to embrace that it's a normal thing that is happening. Many of our women and many of our men are actually undergoing it. So there's no shame in it at all. Yeah. What's the ratio to men to women? Yeah. So it's 3-to-1. More women are doing it. Men, they mostly do it for when they have male boobs, when they want enhancement in terms of size, and mostly hair transplants. We're seeing more and more men embracing that. Yeah.
In the end, plastic surgery has been booming in the past decade. Statistics indicate that nearly 32% of women go under the knife each year to not only feel good about themselves, but to also fit into societal pressures. This has been Joan Junge, Look Up TV, Nairobi.
All right, awesome piece there by Joy Joan. Thank you so much for that, and just highlighting the plastic surgery here.